My name is Sarah Glover, and I will be doing my PRECEDE-PROCEED model on a diabetes intervention program. The PRECEDE-PROCEED model will be utilized to develop an intervention program based around diabetes prevention to change problematic behaviors with individuals who are at risk for diabetes and to improve quality of life for those already living with the disease. Diabetes is a disease that causes blood glucose levels to rise higher than normal, causing an imbalance in the homeostasis of our bodies. Type 2 diabetes is the most prevalent form of diabetes in Americans. This disease causes the body to not use insulin correctly, and over time, the body cannot produce enough insulin to keep blood sugar levels normal. Insulin is formed by the body through production of complex substances from simple molecules. The body becomes insulin deficient when the transport of glucose and amino acids into cells is diminished, which leads to abnormal carbohydrate, protein, and fat metabolism in the body. Diabetes is a disease that affects many Americans, approximately 9.3% of the population, and 10.3% of adults 20 years and older. This equates to an astounding 29.1 million Americans. Of this 29.1 million, 21 million were diagnosed, leaving 8.1 million undiagnosed. An alarming 1.4 million Americans are diagnosed with diabetes each year. According to the American Diabetes Association, in 2012, 86 million Americans aged 20 years and older were diagnosed with pre-diabetes, up from 29 million in 2010. With these numbers, it is clear to see how many lives diabetes can and is affecting. Diabetes is the seventh leading cause of death in the United States, with 69,071 deaths from diabetes reported on death certificates. The PRECEDE-PROCEED model is a framework that is often used by health educators to supply a structure and to support program planners in developing health promotion interventions. This model describes factors influencing health outcomes and provides a comprehensive structure for health needs assessment, program design, implementation, and evaluation of health promotion programs. The PRECEDE phases involve assessing several different community factors. They include social assessment to determine the social difficulties and requirements of a certain populace and recognize desired outcomes. Epidemiological assessment to identify the health detriments of the identified issue and establish priorities and goals. Ecological assessment to evaluate behavioral and environmental detriments that predispose, reinforce, and enable the behaviors and lifestyles that are identified. The model also recognizes administrative and policy factors that affect implementation and match appropriate interventions that inspire desired and probable changes. The model explains that predisposing, reinforcing, and enabling factors have an outcome on behavior and the environment. And through behavior and environment, predisposing, reinforcing, and enabling factors have an impact on quality of life. PROCEED stands for Policy, Regulatory, and Organizational Constructs in Educational and Environmental Development. The phases include implementation, which focuses on design intervention, assessing availability of resources, and implementing the program. Process evaluation that evaluates changes in behaviors and outcomes, and outcome evaluation that identifies whether or not there is a decrease in the incidence or prevalence of the identified negative behavior or an increase in identified positive behavior. An intervention program developed with a PRECEDE-PROCEED framework applied would ensure that an appropriate approach to planning, implementing, and evaluating a diabetes promotion program that would benefit the individual as well as the community takes place. The diabetes promotion program will address all 8 phases of the model to form general and specific outcomes, leading to creation, delivery, and evaluation of a program. The setting the intervention program will take place will be within a community where it is easily accessible by all types of individuals, such as a community center. It is important to get the community involved within a PRECEDE-PROCEED model because it is a participatory model and is successful with community involvement. Community involvement leads to community buy-in. The target population will be young adult minorities in their 20s and older, as this is the age group that is largely affected by diabetes, that are living in lower income areas. The Diabetes Intervention Program will deal with properly educating individuals on the disease of diabetes. It will include ways to avoid the disease for those that are at high risk for developing diabetes, as well as giving options to manage the disease for those already living with it. The program will focus on changing individuals' attitudes towards diabetes so they can better treat it, as well as taking a community approach to lessen the prevalence of the disease. Another important, though difficult, aspect of any education program is to alter human behavior. The significant factor that will need to be addressed in this intervention program is how to change the attitude of individuals and the community so they are able to properly manage and treat the disease. This can be done by utilizing different theories to support why behavior happens, what the factors are that enable or encumber behavior, and how an instructor might create an intervention program that effectively promotes what is desired. The first theory that will be beneficial in developing an intervention program based on educating individuals about diabetes prevention and management is that of the health belief model. This model is the most basic and widely used model that focuses on the intrapersonal level. It focuses on explaining why an individual's action or lack of action to change his or her behavior results from the person's evaluation of several constructs. It mainly depends on a person deciding if they are in danger of developing a disease or condition and the severity of said disease. An intervention program focused on the education of diabetes and how severe it can become if not treated will use a health belief model to change individuals' attitudes, behaviors, and perceptions of the disease. The next theory that will be utilized in this intervention program is that of social cognitive theory, which focuses on the interpersonal aspect of behavior. This theory will be useful in the development of a diabetes intervention program because it will provide a context for creating, executing, and assessing programs by looking at the relationship among the environment, people, and their behavior. This theory will provide individuals with opportunities to learn new behaviors and modify existing ones to help not only themselves but their community. Community level perspectives are also important strategies within intervention programs that strive to assemble community members and organizations to modify the way social systems function from an environmental standpoint. This is a main focus in a PRECEDE-PROCEED model for intervention programs. The goal of this community-based approach is that interventions that address behavior on multiple levels will lead to greater change and be able to sustain themselves for long-term health promoting benefits. The social ecological model, SEM, will be useful in this program as each level functions to examine the behavior in relationship to the other levels, individual, community, and societal. These perspectives will not only give the individual person strategies to deal with diabetes, but also help them educate the community on the disease as well. The PRECEDE-PROCEED model is composed of 8 phases. One particular phase is phase 3, which is focused on educational and ecological assessment, which addresses mediating factors that positively or negatively affect a positive environment or positive behaviors. These factors include predisposing factors, enabling factors, and reinforcing factors. Predisposing factors are ones that can promote or hinder enthusiasm to change one's behavior based on attitude or knowledge. Negative predisposing factors associated with diabetes can be individuals' lack of knowledge on the disease and how to maintain and better treat the disease. If people are not educated on the risks of the disease and how they can prevent certain outcomes, they may not have the motivation to change their current attitudes or behaviors towards the disease. Positive predisposing factors would be the development of a diabetes intervention program that is easily accessible to the community in a positive and friendly environment to give them the education and the knowledge on the disease to change their attitudes and behaviors. This would start by assessing participants' knowledge of diabetes through a multiple choice questionnaire with answers yes, no, I don't know, including questions on diabetes. Enabling factors are those that can either encourage or deter an individual from change, including access to resources and skills. Examples of enabling factors that may discourage one from changing their habits towards diabetes are the lack of availability to certain resources and facilities, such as exercise equipment or programs, healthy food, and education programs. To address these problems, the Diabetes Intervention Program would provide access to exercise facilities for free or very low cost to those that participate in the program. Vouchers would also be given to purchase better food options through fundraising and donations from the community. The last category is reinforcing factors that aid in motivating individuals by providing feedback or rewards. A reinforcing factor that has shown to be successful with individuals who are faced with certain serious diseases is to have family support. Many individuals who are low income and come from broken families may not have this family support. An intervention program will have staff that is very supportive, understanding, and sympathetic of these individuals, who will provide the nourishment that they need to fill that void in hopes of changing their attitudes and behaviors towards diabetes. An incentive program can also be incorporated into the intervention program. An exercise and weight loss challenge can be included, and top performers would earn cash prizes and gift cards to gyms, healthy food markets, etc., that will promote their newfound attitudes and habits towards diabetes long after the intervention program is complete. Needs assessments are utilized within health education programs to better understand how the health of a group of individuals within a certain site or community can be improved through information on both their current health status and their ideal health status. It is a formalized approach to gathering data in order to identify the needs of a group of individuals. Many of these needs assessments are conducted in settings such as schools, universities, hospitals, workplaces, and nonprofit organizations. Needs assessments can be tailored to assess the interpersonal, institutional, community, and policy factors that play a role in the health of a certain group of individuals. A needs assessment will be conducted in conjunction with the development of a diabetes intervention program focused on young adults who primarily fall into the lower socioeconomic class and are considered a minority. This will be established by using primary and secondary data collection techniques to assess the target population for their quality of life and develop priorities for the Diabetes Health Promotion Program. Primary data is new, original data that did not exist before and will be obtained directly from the target population within the community. For example, by the means of surveys, interviews, focus groups, or direct observation. Secondary data is data that already exists that was previously collected by someone or for another purpose. This can be from sources such as peer-reviewed journals, vital records, and census reports. Quality of life will be the most important thing to consider when developing the intervention program. Everyone wants to have the best possible quality of life, and just as diabetes can affect an individual's quality of life, an individual's quality of life can affect their diabetes. Primary data collection efforts will initially be used to decipher what these needs are within the target community in order to establish a diabetes intervention program that will bring about the greatest quality of life for the population in question. Aspects of life with diabetes that may affect one's quality of life include the demands of diabetes care, such as eating carefully, exercising, monitoring blood glucose, and scheduling and planning appropriately, symptoms of low or very high blood pressure, and fears about or the reality of complications. Primary data will be collected through the use of focus groups and questionnaires conducted and given out within the targeted community. Interview and survey questions will involve some of the following to estimate the population's quality of life. How satisfied are you with your physical health? How satisfied are you with the amount of work it takes to manage your diabetes? Do you often feel overwhelmed by the demands of your diabetes? Do you feel depressed? Do you feel you can't do things that are important to you because of diabetes? Do you feel you have adequate access to resources to manage your diabetes, such as physical activities, healthy food options, quality and affordable medical care? This will be a means to establish what the community feels is lacking for them to establish quality of life and what the diabetes intervention program needs to include to be a successful resource for this population. Other interviews will be conducted with key players within the community that can provide even further insight, for example, medical professionals, human resource directors, and union leaders. Secondary data will be utilized through the research of pre-existing sources and statistics to gain an overall big picture, as well as how to proceed to address the health problem of diabetes. In order to gain further understanding and determine a target population for the intervention program, prior statistical information is utilized for the needs assessment. For example, CDC prevalence estimates show that diabetes is more common among Hispanics and non-Hispanic Blacks in the United States. The Hispanic population alone accounts for 48.4% in Riverside County and Black or African American 7.1%, based on a population of over 2 million. Of the total population, 16.2% are living in poverty and 10.9% are living without health insurance. Based on these statistics, a diabetes intervention program aimed at helping lower income Hispanics and non-Hispanic Blacks would be beneficial within the Riverside County community. Questionnaires also exist that have already been conducted and can provide further support for the primary data collection that will be utilized. For example, authors for the Journal of Diabetes Science and Technology conducted research by having individuals with diabetes conduct a two-part patient-centered quality of life questionnaire where they nominated 5 aspects of general and diabetes-related life adjudicated most significant for their overall quality of life and rated each for current level of satisfaction. The scores from this questionnaire were then compared with a reference measure, the Diabetes Control and Complications Trial Diabetes Quality of Life Score. These results can be used in conjunction with the interviews and questionnaires gathered directly from the target population in the primary data collection phase to develop the diabetes intervention program focused on improving quality of life. The population that requires knowledge and access to diabetes programs is growing worldwide. Information and support is needed throughout the community where it is accessible to all and delivered in a format that is understood, regardless of literacy and socioeconomic status, if a difference is going to be made in reducing the rates of developing diabetes and improving the control of existing disease. Utilizing qualitative and quantitative approaches together, as stated above, to gain perceptions and misconceptions of community members backed by statistical data can help in the development of a diabetes intervention program that will benefit individuals involved with providing them pertinent information on diabetes and improve their quality of life. Goals are used to set a program's directive and intent and to clarify what the priorities are in the health promotion program and state the end results that are expected to be accomplished. A program's objectives are more specific steps that need to be accomplished in order to achieve the goal. Objectives are specific and measurable that give a timeline of when each objective will be met and are clearly stated. Process objectives describe the infrastructure improvements that are necessary to achieve desired outcomes in the diabetes prevention. Impact objectives are utilized to recognize necessary changes in the actions or behaviors of the priority population. Outcome objectives directly relate to increased detection and implementation of effective lifestyle interventions. They express the ultimate result of attaining the program goal and objectives that will lead to long-term population-based change in the prevalence and complications of diabetes. The first goal for the diabetes program will be to prevent and manage diabetes among young adults who are lower income minority groups who have prediabetes and type 2 diabetes by helping them to increase their physical activity, improve their eating habits, and reduce their weight. The first process objective will be by the end of year 1, the diabetes intervention program will be implemented in 75% of lower income communities within Riverside City and Riverside County. Objective 2, the impact objective, will be that by the end of the program, 50% of the participants will have reduced their weight by at least 5 pounds and increased their exercise activities to at least 30 minutes a day, 3 times a week. The second goal of the diabetes intervention program will be to help low-income minority communities become health conscious through increasing public awareness and working with healthcare providers and creating physical environments and policies that promote healthy lifestyles. The first objective, the process objective, will be that by the end of year 1, 75% of local hospitals will recommend the diabetes intervention program as a key component in patient care plans. The second objective, the impact objective, will be that by the end of the program, 70% of program participants will take advantage of a no-charge annual checkup screening to decrease the prevalence of type 2 diabetes by monitoring the disease. The last objective, the outcome objective, will be the number of medical screenings for prediabetes and type 2 diabetes provided to low-income minorities will increase by 50% by the year 2020. The final goal of the Diabetes Intervention Program will be to help increase funding for prevention activities. The first objective, process objective. During the first 6 months of introducing the Diabetes Intervention Program to the first low-income community, 3 fundraising events will take place to increase funding for the program. The second objective, impact. Within the first year of implementing the Diabetes Intervention Program, the Diabetes Program will use funds raised to introduce the program into 75% of low-income communities within Riverside City and County. The last objective, outcome. By the year 2020, the Diabetes Intervention Program will have successfully raised enough funds to expand into adjoining communities within a 50-mile radius of Riverside County. Developing a budget for any health promotion program is a vital step in the planning process. A successful program will carefully adhere to a budget and report any variations in the budget from what was originally planned and what actually happens. A budget outlines the resources available to a program and the cost to implement it. Below, I have provided a sample projected budget for the Diabetes Intervention Program. The estimate total expenses for the program will be just over $187,000. A NAT chart can be used as an illustrative model to provide a visual element of a health program and a timeline of components to be completed that build one after another. It provides a visual portrayal of the schedule for completing a program's objectives. The below NAT chart is provided as an example of what is to be accomplished during 1 year of the Diabetes Intervention Program within a community. The Diabetes Intervention Program will include formative and summative evaluations in order to answer stakeholders' questions and help with program decisions. Formative evaluations will be held during the diabetes program development and implementation process. These are useful to help provide the best starting point for the program, to help avoid pitfalls with implementation, and to best guide program improvements during implementation. These formative evaluations were discussed earlier in the needs assessment and will involve focus groups and survey questionnaires to address the needs, behaviors, and attitudes of the target population, young adult minorities living in low-income areas. This step in the program implementation will evaluate what works and what does not prior to the program taking effect. It will measure which patients have received what service, when they have received the service, how the service has been delivered to them, and so forth. Formative evaluation will be used to monitor program functioning and will use to also modify the functioning of the program if need be. Summative evaluation will determine the short and long-term changes that occur as a result of the program. It will measure the impact of the Diabetes Intervention Program on individuals' lifestyle and health. Short-term changes will include assessing behavior changes in individuals after the completion of the diabetes program by taking final weight changes, BMI levels, and an overall health checkup to see how their health has improved or complications of diabetes have diminished. Long-term changes will include doing ongoing follow-up with participants to track their behavior changes and health after the program in order to assess how effective the program is after completion.